It's my turn. This is Let's Talk Radio, getting to the root causes of the important issues of the day. We've got one today, too. This on-the-air community, what's that, forum believes, I'm going to have a surgery, by the way, on the 21st.
Oh, that's right.
I might be able to see. Believes your voice matters and welcomes all thoughts and views without judgment. Please join today's conversation by calling 415-663-8492 or tweet us at Let's Talk on KWMR.
And what are we talking about today?
Healthcare, yeah?
Healthcare in the United States.
Oh, and we could begin with an announcement. You have an announcement here, this piece of paper, Shelley Rugg.
Oh, yes. Well, as a matter of fact, tomorrow, Westmoreland Standing Together is hosting an event to discuss healthcare. It's a healthcare town hall happening at Westmoreland School, I believe in the gym.
No doubt.
And it's a free event, but you need to reserve a place at the event by going to eventbrite.com and type in Jared Huffman and Point Reyes Station. Jared Huffman will be there along with Ellen Carell. Liza Goldblatt is the moderator. Dennis Rodoni is also going to be there, as well as Judy Spellman.
Of Medicare for All. Is she part of the Sanders organization? Because that's the name of his new bill that he just introduced.
I don't know. I think she's a member of Westmoreland Standing Together, but I don't.
Excellent. And actually, it says I have a thing from Bing, and it says you don't have to go to Eventbrite. There's plenty of seating.
Okay.
Oh, wow.
Well, that makes it easy to show up.
Just turn up.
It's 7 to 9 p.m. Friday, September 15th, which is tomorrow evening.
And my name is Charles Schultz. I'm here with
Paul Riffel
and
Stephen Hurwitz
and
Shelley Rugg.
And this is Let's Talk 415-663-8492 to tell us what you think about healthcare. But your introduction to this, Paul Riffel, was a little more specific than that. It was a little more involved. It wasn't just the word healthcare.
Actually, I didn't write that. I edited it somewhat. It was Stephen's lovely bride, Gail, who is her actually a doctor, a medical doctor.
I call her my girlfriend.
Oh, I see.
Keeps it fresh.
I was at the wedding, man. I know. So she actually she wrote the draft for that, and very good. And what a happy coincidence that there is this Westmoreland Standing Together thing tomorrow. Maybe not a coincidence at all, but what a happy coincidence that Bernie just introduced his Medicare for All, and that some of the perhaps the future presidential nominees or candidates are lining up behind it, because now it's an acceptable thing. Apparently, is it socialism still? Are we not worried about socialism?
Actually, it's the takeover of healthcare by the U.S. government.
That's right.
So is this a concern? Is it, what is the?
Well, I think the states know where to spend their money. I don't think the U.S. government should have it. I think we should allocate the money to the states. They know better. They know better.
This is the issue more about definition, because, what is healthcare? We don't seem to have a very good answer for that. And so if healthcare is just endless pills and surgery, then this would be something that would kind of run out of control, and all the people say it's too expensive would probably be right.
Well, I think the argument is that endless pills and surgery is what we have now because that's where the money is, and
Right.
it's not in so much in prevention.
Yeah, I believe I read an article the other day that, there's countries that do have healthcare for all actually focus their attention on wellness
Yes.
care.
Yeah.
Because they want to cut costs.
They want to
because
save
the government
money.
doesn't want to spend money, right?
Right.
Well, I think Gail will
Keep
tell you
people
that
healthy.
doctors are rewarded for treating illness, not for keeping their patients well.
Isn't that the
subtle
point?
distinction?
Yeah, because one in the Sacramento Bee, I sent this to Paul Raffel. It was prescriptions for opioids per 1,000 residents in California counties. The lowest was Alpine County. It was sober, a lot of walking up hills, I imagine. Marin has 585 prescriptions for opioids per 1,000 residents. Right, so if all of if it was one prescription for one person, it would mean that 58% of all people in Marin have a prescription for painkillers, and but Trinity and Lake County take the cake with 1,400 prescriptions per 1,000 residents. So that means 1.5 per person, and so I mean there's a kind of crazy situation there with this the last 25 years, this huge explosion in prescribing pain medication to people, and how it's become addictive, how it's become its own sort of economy within itself. Certainly in lower income areas across the United States. So low income.
So what's in it for doctors to do that? I mean, physicians are
It's
prescribing
easy,
things.
right?
I think they get paid to prescribe.
They get paid. Don't they get paid per visit? I mean, isn't that how that works? So what's easier than, you got pain here, just take this.
So they don't
Used
get
to be
kickbacks
aspirin.
from the pharmaceutical companies?
No, I don't think so.
Oh, really?
No, they don't. I don't think they.
We have so many
But
health.
they do
prescription?
get lots of.
The swag is
incentives?
over.
benefits.
The swag is
The swag
over.
is over?
The
Swag is over.
Really?
Well, we have so many
Well,
health.
we have some good cups from the.
But
old
what
days.
about the guidelines that are put forth, to doctors on how to treat various things? You treat this with this pill, or you treat that with
Sure.
this surgery, and that's sort of set up for them.
Well, there was a concerted effort by the pharmaceutical industry to say that doctors were sending patients home from procedures with too much pain. In the 90s, they really started pushing this, saying that this pain that they're having to deal with is this big problem, and so doctors are under-prescribing painkillers for the procedures and operations and this thing and that. But we have a caller here.
Well, I know it used to be when Donna was having her terrible chronic pain, it got more and more difficult to actually get opioids at the clinic here.
Weird.
It was more and more paperwork. They would only give her a certain amount at one time because didn't want to sell them on the streets. Hi, you caller, you're on the air. What's your name, please? Turn down your radio and please watch your language.
Hi, guess who?
At least we have an expert now.
It's Dr. Gale, yes.
This is Dr. Gale.
Someone who knows of what she speaks.
A bit.
How much money are you getting from the pharmaceutical industry, Gail? Answer the question.
But, Paul Charles, you brought up a pretty good point. This pendulum swing around the opioids it's kind of a fascinating thing because there was a period of time when it was felt that people were being underprescribed, for sincere pain, for real pain. And there was at the same time, though, when drug companies started advertising in public, on TV and things like that, there was also much more of a public demand. I mean, there were some interesting studies that showed that if you treat pain, for instance, early on with an injury or surgery, people recover faster. But it's gone so far overboard for a matter of convenience and patient demand and so many things. And now there's a very, very concerted effort to pull back, which unfortunately, sometimes put people with genuine pain at a disadvantage, having to jump through so many hoops to get the medication that they need to function. So not a perfect system.
Gail, didn't you have your own experience with that in terms of prescription of opioids?
I had a relatively minor procedure, and when I went to pick up the pre-medications, antibiotics that I was supposed to take right after the surgery and that sort of thing, I had a prescription for like 50 Vicodin. And I remember thinking, is there something you're not telling me about this procedure? Or, I'm being pretty angry because I know very personally, what a problem it can be to have that kind of medication out on the street. A lot of the abuse happens because people have excess medicines in their cabinets, and then other people dip into them and use them. And
so you had enough.
They're much more. I'll tell you another thing. They're much more addictive than I would have ever imagined. Even after 2 or 3 days of using sometimes just a half a tablet a day, I started finding myself looking forward to using them and stopping, of course. But pretty humbling experience to realize how potentially addictive they really are.
Wow.
Anyway, it's a big thing. I wanted to, if it's okay with you guys, I just want to circle back a little bit on the beginning of the conversation.
Mm-hmm.
Tomorrow there is a health forum. It's a community forum for West Marin and all of the districts, served by Jared Huffman and by Dennis Verdoni. And they will be there along with Ellen Carroll and Judy Spellman, who are really people who have been working for decades to create a system that allows health care coverage for, all the people in the state and all the people in the country. Ultimately, it's a movement that it's pretty exciting to see it gain momentum. Even with Bernie Sanders' proposal, people starting to have a language and so much less fear around what it might mean. As a person, in our age group, getting Medicare is like the best thing. You look forward to it. I mean, I went from paying over $900 a month for health care to, just over, about $275 for Medicare, supplemental, and prescription coverage. And I have virtually no out-of-pocket expense. The system, the idea is that the system then is extended, say, to 55-year-olds and to make sure all children are covered. I mean, even Affordable Care plan has gone from 17% uninsured to only 7% uninsured. Still, lots of people need to be addressed, but you can see that the public is getting more comfortable with the idea that health care is a right and that taking back that control is something that's going to happen largely at the grassroots level, that we're waiting for the government to hand it to us isn't entirely realistic. It's amazing to see the conversation gain momentum. But tomorrow night's forum is a chance to really hear our representatives talk about what's going on with affordable care, what's going on with in Washington around these new proposals, what our local situation is, and then after, the focus, which is healthcare, to have a chance to really interact with the representatives in a very personal situation. So it is 7 to 9 p.m. This is my pitch at West Marin School. There's plenty of room for everyone, alternative parking at the church, and just come tomorrow night, 7 to 9 p.m., and be part of the community, part of the conversation. Come and learn from people who really are immersed in this and have a lot of important information to share, a lot of confusion to clear up.
Yeah, it sounds wonderful. It's just what we need is to be able to talk to our representative. What's the status right now in California? There was a bill that was passed by the Senate, but destroyed by the Assembly for health care for all, I believe.
Well, I think it's Bill 562, and it was passed by the Senate, and the governor, had said that he would not sign it. Doesn't seem to be his priority.
Because it has to be paid for by taxes, by a tax increase.
Well, it's more than a tax increase. The tax increase is a part of it, but it also replaces, our insurance premiums. It's a combination of payroll tax, some changes in the tax code. I think that the reservations are largely around some clear path to how it's going to be paid for. But, when you run the equations on what you mentioned, which is the benefits of having preventative care become more of a priority and having people insured, for the care they need, the numbers really are, every country, every Western country in the world literally has figured out a way to make the financing work. Yeah. And that is something that will happen too, but there's just resistance. It's like every little salvo. You get a little closer, it gets a little further. More people come away understanding and less afraid of the of the word.
Right. It's true that from what I've been reading this week, it's that there are a lot of advocates for incremental change and for shoring up the Affordable Care Act rather than remaking the entire thing and increasing taxes on corporations and the very wealthy, because that's where...
And this is coming from
Republican
governors are calling for that, shoring up the Affordable Care Act.
Rather than doing this. Yeah, right.
Amazing how it starts looking good, huh? Well, I think I think that the most important thing right now is to continue to call it Medicare for all. Medicare is a system that people are familiar with. They understand it. They know that it works.
Right.
And the truth is that Medicare is a public-private cooperative. In other words, you still get your insurance through the insurance companies, but the rates are more controlled, and the what do they say it? The rates are more controlled, and the government has more opportunities to negotiate, say, better fees for pharmaceuticals and medical supplies and things that right now are pretty off the page.
Are physicians... I'm sorry, go ahead.
No.
Are physicians happy with this setup right now?
Medicare is a bit cumbersome from the physician standpoint. It has some limitations on getting paid, and, the government part of it, can change those payment structures and withhold them sometimes. But in general, it's a working system, and if it were the system, I think a lot of those would become standardized and would become ironed out. The general feeling is, more and more physicians are getting comfortable and are coming to see that the system we have now is so dysfunctional, and there are so many compromises already to our ability to practice good care, that they're getting also more comfortable with the notion that some kind of change like this is inevitable and just has to happen.
Could you address maybe, Gail, this issue of going back to earlier of preventative care, in the sense that we have an economy and a way of living that produces terrible disease, produces type 2 diabetes, it produces serious mental health problems, which, migrate very naturally or are associated with physical health problems. And so you come along and say, well, you've been utterly and completely poisoned and destroyed by this way of living, and we're just going to come in now and treat all of those diseases, rather than saying, well, maybe we need to live a different way that would mean that you would need to have this massively expensive regime of therapies and surgeries and things like that. How do you deal with that?
Well, I don't think you've laid out the problem accurately, so I don't want to take off quite from there.
How would you lay it out?
Well, I would just say that there is not sufficient emphasis on prevention, on lifestyle improvement. There are more and more models that are focusing on helping people change behaviors that lead to chronic disease, which is like 80% of the illnesses that we deal with, I think, in healthcare, and that the economic model that we have now does not encourage that. So, you as a family doctor, you can't get paid for spending an hour with a family talking to them about, nutrition for their children or changing or avoiding, negative habits.
But you could refer them to a program potentially, right? That
well, you can, but it may not be covered by your health insurance. It may be, someplace like Kaiser, for instance, has more emphasis on that because they are a single pool of money. They use it. The healthier their clients are, the more money they keep in house, if you will. Right. But in general, it's like a sort of a pie, It's like if you go to a physical therapist and you don't need surgery, but then the surgeon doesn't get the money, the physical therapist gets the money. It's like you can't. You have to keep going back further and further to the root of the system in a way. we live in a place where a lot of people take a lot more personal responsibility and a lot more awareness to their health here, but there are places, states where, the obesity rate is off the page and the smoking and,
And in poor urban landscapes where there's there's a food desert. All they've got is the convenience store, and they may not be able to afford to drive out to the mall out in the suburbs.
Well, and California has the highest poverty rate in the country, but that is a function of the wealth disparity.
I didn't know that.
Yeah, well, if the Central Valley became its own state, it would be the poorest state in the Union. It'd be poorer than the Deep South.
Wow.
But as a function of the sort of average income and things like that, California moves way up to the top. So we have those poverty issues, like I said, Lake County and Trinity County are the examples I use for opioid prescriptions, if not addictions.
Can I say, I don't want to tie up the phone line in case other people want to call, but I'm not sure.
Well, there is another phone line. 415-663-8317 is the other number. We can call in. And, let me just say that you'll hear a little buzzy sound as I put you in the system. Just hang on until I say you're on the air. And please turn down your radio and watch your language. Anyway,
Well, I think what Gail was saying, you get down to these root causes, isn't that where the emphasis ought to lie? Which is so that all of this sort of putting a Band-Aid on an industrialized or urbanized way of living. You talk about people's commutes, people's sedentary lifestyles, people's diets, people's things like that. That somehow we need to deal with the problem on that level, that if you come in and say, well, the state will backstop how hideously unhealthy mentally and physically our, quote, normal way of life is, I wonder how helpful that'll be. I wonder if we're not avoiding one problem and saying, well, we'll deal with this palliatively.
No. But you know what? If you look at countries that have universal health care and all sorts of things, I mean, there are still smokers in those countries. I don't know that I've seen a comparison of the rate. But I just think people, do stupid things. I don't know. I mean, I don't think that you can control for all of that. I think that the point of this question is health care a right? And is it something that we as a people want to afford, for ourselves and for all the people, in this country? And is there a way that we can do that that's viable?
Well, when you say health care is a right, let me ask you, Gail, something that's considered totally voluntary and contemptible, and that everyone is free to criticize and does so gleefully, is smoking. So if I get lung cancer, do I have the right to treatment under this idea of universal health care, or am I a naughty boy that is going to have to deal with the consequences of my own irresponsibility?
There would be no reservation in treating anyone for whatever illnesses that
whatever's
they had.
there. But
I mean, I've never seen or heard anyone who is suggesting, that there's going to be a panel that decides
the death panels
whether you earned your illness or not.
So we're stuck.
So what?
He's going to keep smoking.
That's right.
I'm just thinking about the arguments against, right?
Mm-hmm.
So what are the arguments against moving towards Medicare for all?
Oh, well, it'll be raise taxes. That's what all the Republicans are going to hammer away at. Who's going to pay for it? What are you going to do? You're going to take away money from the military to pay for this? Look at North Korea. Well, I think they've got health care for all. Oh, that's right. They do.
I would say if it diverts our focus from dealing with the sort of underlying endemic unhealthiness, so to speak, of the way in which we live, our economy, then yeah, it's a problem. I mean, it's saying continue to live in such an unhealthy way, which people don't have much choice about.
But that is a part of, as we said earlier, that's part of national health care, is that when it's nationally funded, government funded, the government wants to save money. They don't want to spend all that money on treating things that could be prevented. Prevention becomes part of the whole thing.
Sounds really good.
In other words, it changes the emphasis and increases the emphasis on it. It doesn't make one go away in favor of the other.
Right.
So is that a concern to physicians would their pay rate drop, or do they maintain their pay rate under Medicare for All?
Okay, so here's two sides that I have read. On the one hand, it should not dramatically change the pay rate. Theoretically, primary care would have some increase in their pay rate because they would be compensated for a lot of the services that are now not considered priority. The specialist might have a small decrease, but they would also have a better flow of clients. It's a funny rubric because it's all speculative. There's some question, that when doctors had less control over how they billed, it could change their income, but that's just the way the system is sort of gamed because it's already so messed up. It's so hard to just get compensated for the stuff that you do. I mean, the system is just broken.
And
it's you have to unravel all the ways that people have compensated for the broken system. But I think that when you talk to physicians in Canada, not that we would have an identical system. I mean, the relief of just having a person come for a problem, seeing them, taking care of them, and having them go home with a treatment. I think that I think it's a natural response for physicians to be afraid of something new, or anybody to be afraid of a change.
Sure, it's
guarantee or not guarantee of how it will in fact turn out. But the system we are under now is already painful.
But so the big money in insurance companies and in the pharmaceutical companies will be lined up against any proposal like this because there will be limits on what the government will pay for drugs, right? And there will be...
Bye-bye.
And does this mean that private insurance is going away, or will it be... I haven't read Bernie's plan.
Medicare is administered, through private insurance companies, how it was in the charter, and some public-private collaboration may, in fact, be the solution we wind up with. The fact that big money and big government resists something is why it's so excited to see what is essentially becoming much more of a grassroots movement. I mean, these Republicans, whoever are now asking to improve the Affordable Care Act, that is the reason that they had people storming them in their meetings, which is, again, why people should come to the public forum. Our people, our representatives kind of need to know what we want and how we feel so that they can go back to Washington or wherever and represent those views. All of a sudden, it wasn't so popular to take away people's insurance. They had to reposition, they had to do a quick shift.
Well, and also I read somewhere this week that almost half of our population is already on government-funded health care. Medicare, Medi-Cal, Medicaid, and the VA. It kind of adds up to several, I think it was 100 million or something, 100 million people in it.
That sounds like a lot. Do you know what, Paul? Could you just repeat the other phone number? Because there may be some people from the Health Committee for West Virginia together that's putting this forum together that
absolutely
I would love to call in if they have anything to add.
And anyone,
expert on this.
Yeah, please give us a call. 415-663-8317 is our other line. And let me just say that this is 90.5 KWMR, Point Reyes Station. 89.9 in Bolinas, 92.3 San Geronimo Valley, streaming alive and archiving on KWMR.org. And KWMR is supported by our listener members, thank you, and by Marin Agricultural Land Trust, a member-supported nonprofit organization working to preserve Marin County farmland, on the web at malt.org. That's MALT.org. And we're also supported by Whistle Stop, providing support and transportation services for older adults and people living with disabilities in Marin County, presenting a benefit concert called Whistle Stock in San Rafael on Sunday, September 24th, featuring food, dancing, a 60s and 70s costume contest, and music from Jesse Colin Young and Pure Prairie League. Tickets at whistlestop.com. KWMR.com. There you go. Thank you to our underwriters. And, do give us a call, 415-663-8317, or you could tweet at KW, what is it? At Let's Talk on KWMR.
So, and the other number, 415-663-8317. 8317.
So where are we? Let's see.
Could I throw
what
another
are the
thing
objections?
in the mix? I'd like
Yes.
just in the mix. I read somewhere that a vast majority of our healthcare dollars are spent on the elderly in the last years of their life.
Mm-hmm.
Last 2 weeks of their life. Is
So-
what I've heard. It's the last 14 days of healthcare is the majority of its cost.
So let's throw them on the ice?
Oh,
or-
you better. If we don't have any ice left, that's a problem. That's why we need to solve climate change now, so we'll have enough ice flows to deal with our medical costs. Well, I do think
So what was the so yeah. So the most of the healthcare costs are spent on the elderly. So
I don't get old. I don't have
mulch the
answer.
elderly. Don't get old. I've
you
heard
were
that
just
before.
bringing that up.
I-
You don't get old. Yeah, well, that's true, and we're all on Medicare, all us old farts. Oh, yes, you can say that.
Well, I would,
and
I would just say that you'd have to don't get poor is the real thing here. So in the United Kingdom, they have all sorts of public health initiatives, and one of them that's popular, and they have television campaigns for it, is have your 5 a day. You have to have 5 fruits and vegetables a day, and this will give you a longer and healthier life. When some journalists went into the data, what they found is this overwhelmingly correlates with class, which is that the people who have 5 fruits and vegetables a day are at the top of the society socioeconomically. They have more time for things like exercise. They have more leisure in their life. They have been getting healthy food throughout the course of their life. And so, people say, well, we need to have this new institution to take to take responsibility, in essence, for this terrible health crisis that we have in the West. Or you could say we need social transformation. You need to create the conditions in which more people can enjoy the lifestyle that people say in West Marin enjoy, which is filled with fresh fruits and vegetables. It's filled with leisure. It's filled with exercise, etc.
Fresh air.
So it's the idea that the government comes in, creates a new institution, and treats the byproducts of poverty, essentially, and horrible ways of working and living. I wonder if that's going to have the outcomes, or it's going to have the effect that people think it will. I can imagine it, breaking down under the weight of not wanting to change the way we live and survive, but just trying to bring in the system that's going to say, okay, you've got these horrible diseases, you can have this, 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 and this. I wonder how much that will help, or if it won't collapse under the weight of the cost of doing all of that stuff. Maybe not. I mean, cost is often a complete red herring, and people say, oh, it's too expensive, you can't do this. Well, compared to what, right?
Right.
Compared to spending $1 billion or $1 trillion a year on the military. I mean, but you want the social change. You want people to have healthier lives from the very beginning of their lives, rather than say, "Oh, you're 50 now and you need dialysis every day." So
yeah. So, but how can you regulate that? How can you mandate that? You
couldn't.
Yeah, exactly.
But you could create the conditions in which different ways of surviving were possible, right? We can have a different kind of economy. The weird thing about it is that we think of and we describe in metaphor and in language the economy and markets and capitalism with the same language as we describe nature and the balance of nature and ecology. The same words and ideas and phrases are used to describe both ideas, and so we have an idea that the way that we live, with that terrible commute, with that sitting at a desk
Is
all
a
day,
natural thing.
Is a natural. There's no way to change that.
It's just the way humans are.
Well, that can't change, but what can change is dialysis for all, right? You can't have that. Pills for all. That we can do.
Yeah, sure. Well, it's the fix. It's the techno fix for a problem that is deep-seated, and like plastic water bottles with BPA in them, and
It says smart on the side of it.
Oh, well.
I don't know, Stephen. Is it smart water? Is it really smart water?
I just use this. This is real water.
I see.
Well, we're also up against the deregulation of organizations that were put in place to try and protect our environment, protect our food resources, all these things, and that we trust are looking out for our best interests when, in fact, they're actually supporting, the interest of money.
Industry. The industries that are creating the things that are making us sick.
Well, I'd say we create national level or even state level institutions that cannot be responsive to the needs of individuals in local communities and things like that by design. So it's not that when people complain about whatever the things that are out here, people complain about the Coastal Commission or the National Park System or this government entity or that government entity. It's not that the idea of government not having a role in trying to help people live better lives, et cetera. It's that once you bring it up to the scale of the federal government, you're inevitably going to have a kind of standardization or detachment from what's actually going on the ground that's going to create, problems.
That's the problem, isn't it? Is that it becomes an impersonal. Healthcare for all becomes an impersonal thing. It's suddenly you have to fit the cookie cutter thing, which is why it has to certainly be run by states rather than the feds. The feds supply money, but the states put the infrastructure in place, and localities, have to have a role in it as well. It has to be about people rather than just this big, huge. You're just creating another big system, big federal system.
It's the way in which patriarchy is ingrained into the way we live. We want daddy to come in and take care of something, and people are much happier with that than actually trying to deal with something on a local level in terms of what we would use government to do. Daddy, please, daddy, take care of it, or mommy. I mean, same difference.
But there is a backside to that also, which is that if you happen to live in a state, that's somewhat enlightened, relatively speaking, I understand, where you can count on the government or the whoever at whatever level of local you're talking about to be benevolent and appropriate, that's great. But there are states, many states, where when, the reason we have some federalism is because there are a lot of states who set a very low standard for education or health care or benefits or, any social program. And, so the government sets a minimum that says, what, this needs to be addressed. You can't ignore this. You can't leave these people aside.
I agree, Gail. I mean, I think I misused the term. I was saying patriarchy, and they're related concepts. It's really paternalism, and it's the idea that wealthy elites in Marin need to tell Alabama what to do. And I can see why you'd say that, and you could see why you think, wow, we could do all these things to help them. But I think the problem of disempowering those people by telling them how to live their lives creates a deeper a problem of dependency upon the state that I think has lots of downsides too. So I see why people want to say we cannot let these people make decisions for themselves. Look at what they're doing.
These people, in other words, I think that if people actually had more say, but the disempowerment, is at such a low level. I mean, the people who are being most affected by certain policies are nowhere near power. Nowhere near the ability to affect the things that affect their lives.
I agree. A huge disenfranchisement. The other number, by the way, 663-8317. 663-8317.
Give us a call with your opinions on healthcare, and should there be Medicare for all, which is the catchphrase of the day, because thanks to Bernie and to people locally who've been working towards that idea, because everyone trusts Medicare. It's a good thing to hang a thing on. I have to say I was brought up in England, and National Health Service back then was still relatively functional, and it was easy my parents loved the fact that they could take us in when we had contracted mumps or something, when we'd been exposed to it, and that there was treatment, and it didn't matter what it was, you didn't have to pay a thing. And
free at the point of service.
Free at the point of service. And they were willing to, as a nation, they were willing to pay the extra bit of taxes that it took to do that. Now, of course, thanks to the New Labour and to
Thatcher,
conservatism, Thatcher and the people following her, they're gradually dismantling it. They're privatizing the National Health Service, which Yeah,
And-
going
and-
backwards.
And you don't even have to privatize. You can simply set up markets within a public institution. So what they did in England was set up all of these metrics. I think this is what was New Labour. It could have been under Thatcher. So I don't want to point the finger specifically at one person. Not that there's so much difference between those two. Was they said things like we need to reduce the time in the emergency room which a patient is seen. Somebody comes in. So one hospital set up the welcome nurse, who was just somebody who went around and said hello to you, and that brought down the waiting time. Or they said that they needed to have more people in actual.
So they didn't actually see them sooner.
No.
It was just that somebody walked around. Oh, welcome to our hospital.
And that was it.
I have a funny little I have a funny comic like that.
Go on, Gail, please.
No.
Oh.
Reminded me of something funny.
Oh, well, another one, if you want to think up your story, Gail, was they wanted more people in actual hospital rooms and beds and not in hallways on gurneys and things.
Gurneys in hallways.
So what they did is they took the wheels off of the gurneys and reclassified the hallways as wards, and problem solved. So this building...
Wait 1 second.
Go.
Because here in our very county of Marin, and as a result of the federal guidelines, or not just the local, is that now when you go to the emergency room, the insurance companies will not pay for hospitalization if you are in less than 24 hours. So they keep people, in the hall in the emergency room, and then they don't admit them. And when people get home, they get a bill for an emergency room visit, and that it doesn't count as their admission.
So they they won't see them they delay them, so they go over that 24-hour mark, and then they can be billed?
Yep. No, then they can't,
Wow.
so that they are not billed as even if they need to keep them, let's say, overnight for observation, they actually keep them in the ER, and then when the people get home, they realize that they never had an official hospital admission.
They weren't actually admitted. They stayed in the emergency.
I don't know the exact. I really don't remember the exact framework of it. That it's true.
I have to say, I'm not advertising here, but I have to say that Kaiser has always was very helpful with Donna, and I've been on Kaiser for quite a while, and the system works there, and there is a lot of preventive care that's part of the
Much
system.
more.
And dental, and with Medicare, it's wonderful. With the what's it called? The senior
Advantage.
I've forgotten what the name of the thing is.
No,
Anyway,
these Medicare recipients smug in their finery.
No, we're wonderful. And I've heard these horror stories of insurance companies and how they get around actually doing what they're supposed to do. And we never had that experience with Kaiser for many years. So not a plug. Just a personal experience.
So if you have a Medicare system for all, where's the oversight going to come from? Who's going to be monitoring this and making decisions about it? Or have you created a new mega bureaucracy,
of course,
which will create all these perverse kind of outcomes?
Absolutely.
Isn't the emergency room the most expensive matter of providing health care? Another reason for preventive. People who don't get prevention, who don't get adequate stuff in the beginning, they end up in the emergency room, and this is the most expensive way to distribute.
Sure. I mean, I'd say, again, a function of class. People who, don't have any access to care or living dangerous lifestyles, which they get injured and then they, without insurance, whatever, go to the emergency room. And, I mean, presumably, if you had health care free at the point of service, then maybe, lots more people take advantage of it. But how it actually happens in practice, to me, would be very interesting to see. You should see the people who are supporting Bernie's bill: Kamala Harris, Cory Booker, all of these fairly standard issue neoliberal Democrats who are looking to run in 2020. Well, they're putting the support behind it now. Let's see what it looks like in practice. But 663-8317, 663-8317.
And then there's end-of-life care.
Well, we used to have rituals to deal with all of this, and now, because we're, as a culture, so panicked about death, people live in terror of death, that and then the whole dynamics of medical ethics saying you have to do all of these things to extend life, to manage life, to blah, 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 that we don't have a very good way of dealing with that at all. And I've heard that there's those last 2 weeks of life in which, 90% of lifetime medical expenses are incurred. But we don't know we used to know how culturally to deal with people being born, to deal with people dying. I'd refer listeners to Ivan Illich's 1975 text, Medical Nemesis, quite a good book on this subject. But now, we have no equanimity about it. We are obsessed by not dying. And so I feel like a lot of people's healthiness, rather than being some kind of way of enjoying life, is actually a way of avoiding death. They don't seem to be enjoying themselves that much. And the grim jogger, ooh, they're the worst. People, with their misery kale. Speaking of which, I promised to bring kale around to people in Marshall yesterday. I did not. Steve and Nancy, I'll be down with some kale after the show.
Thank you.
They're both medical professionals who should call in 663-8317.
Yes, do call in. We have about a quarter hour to go, so give us a call, won't you, with your opinions about healthcare for all, universal healthcare. What else do you want to call it? Single-payer healthcare. Are they all the same thing? I guess basically they are, but
I wonder. People can come up with this single-payer, and it's a very small group of people that support it or get behind it in the beginning. Really, there's a huge huge need to actually sell this to the population at large.
You think? It's always polled favorably in the United States since the Second World War, at least. I mean, it is not favorable with the people who actually run the society, but when you ask the average American, should there be socialized medicine or should there be, it depends on how you phrase it.
You don't say socialized.
Yeah, should healthcare be free at the point of service, as the NHS, and it's very, very popular. So I don't think you really do need to educate people on this. Who you need to educate are the corporate and political elites that actually run the government. They need to, quote, be educated on.
Paul, something that it comes from people who are a little older, but the new generation, the word socialized does not have the same effect that it had on my generation.
And that happened overnight. If it was 2006 and you would have told me there'd be a black president, I would have been like, oh, really? Maybe in 2024. And then if you...
Somebody running as a social democrat.
I thought about, would we ever have a crazy president?
Oh, no, we've had many of those. What are you talking about? They've all been crazy. Borderline personalities, anyway. But if you would have said that the word like socialism, anybody, even my age, being born in the 1980s, what a word it immediately meant, even to the liberal elites, even to sort of center-left people, it meant that you were unserious. It meant that you weren't, you were just in some kind of academic or hippie sort of la-la land, and that your opinion could be excluded. And just after Bernie Sanders' campaign, all of a sudden, this is a word that is no longer... unthinkable.
Yeah, although the journalistic opinions that I've been reading this week are still saying that basically this is la-la land, who's going to go for it, especially in a Republican-controlled blah, blah, blah. But so they're setting up the pins for, 3 years down the line from now when everything's going to be up for grabs again, and where they'll be pushing for more Democratic seats and try and push stuff like this through.
Well, I think there's a real danger the Democratic Party in 2020 is going to double down on where they've been for 50 years, which is the opposition is Satan, it's fascism, it's the great evil, and so no, we can't have these social reforms. You just have to vote for whatever Democrat there is because the alternative is the end of the world.
Right.
And the problem is the Republicans make this a credible proposition. It does mean, though, that this negative politics has created Trumpism, which is not going to go away. And so if you want to keep pushing this huge portion of the American population further to the right, keep voting for centrist Democrats, because it's just going to strengthen the hand of what Trumpism is. And I mean, maybe not Donald Trump in particular, but it's causing this right-wing reaction by not addressing those problems. But Kamala Harris and Cory Booker and these people who are going to run in 2020, they are going to say, you just have to vote for me, just as Hillary Clinton did. I can't do anything for you. You just have to vote for me.
They're very fluid in their positions.
But interestingly, there are 16 Democratic senators who co-sponsored Bernie's bill.
So Harris and Booker being two of them.
Yeah. I'm not saying they're not;
But-
those guys aren't there. I'm just saying it's interesting to see everybody line up. But look, there's these people play politics, which can be astonishingly frustrating to watch, and to live with the result of. But the thing that's most encouraging to me is that we are having a conversation with real people who in the past felt that fear and confusion around these issues, who are now more clearly saying, I want health insurance, I want it to be secure, I want other people to have health insurance, and I think that it's important to come up with a system that addresses that we can't ignore it anymore. Nobody can make believe that the current system is working.
Which is great news. Yeah, I think it's good that people are getting away from that idea and getting away from the kind of smugness which is endemic in in enclaves like the kind that we live in, which obviously our lives are not touched by poverty in the way so many people in the world are. So,
But when you say the system's not working, we're talking about the Affordable Care Act. So, so if it's broken, though, some people say, "Hey, let's fix it," instead of destroying it.
well, it's an insurance mandate which is never going to turn into single-payer health care.
But this
it's a different thing.
This is the democratic way of repeal and replace, but we're not saying that because we know where that went. Is that true, Gail? Would you characterize
Not really.
it thusly?
I think we have a system. I think we have a system, Affordable Care Act, which is imperfect and can be made better. And the fact that that can be a focus is good, because the conversation that we're having around Medicare for all is one that will happen over a much longer period of time. And even when you look at some of the proposals, most of them will look eventually at saying, okay, well, then we'll put Medicare down to 55, or we'll make sure all children are covered. In other words, they will still phase it in step by step,
Right.
rather than waking up tomorrow morning and having a brand new system. The fact that the insurance companies are involved is a problem, but on the other hand, cutting them out entirely is a big problem, in terms of the level of opposition and the money that they can put into opposing it, and that whole political layer. So, this is a big country. I mean, you look at Sweden, you look at smaller uniform countries that have systems that work.
And no military.
The same.
Sweden is military.
But even Canada, it's a big country with
Not
1/10
very-
of the number of people.
But if you
At a more uniform population, at least, as those laws were formed. So, it's not to say that this is really, from my point of view, just a conversation about moving this conversation forward and faster and in ways that, no one could have even anticipated a couple of years ago. And I think that it's partially the intensity of the Republican determination to take this away from people that has made people look up. In the beginning, people were saying, I didn't know that that Obamacare was the Affordable Care Act. Don't take my insurance away.
Right.
I mean, talk about a level of education at every level that just did not exist before.
Right.
From my point of view, Obama missed the biggest opportunity of the planet. He should have been educating people about this plan from the minute he instituted it.
Well, he's the one that took single payer off the table, though. I mean, he's the one that he started with the compromise.
Yes, but the point is that if people had understood what they were receiving and why and how it was structured and what they were working, the Republicans could never have done what they did. And challenged it in that way. I mean, there
And
was
the
so
Tea
much
Party would
ignorance.
not exist.
But hold on, Gail. I have a question for you, because I asked a healthcare professional who actually deals with administrative issues rather than being an MD or a RN or something like that, right? And I said, so what about the Affordable Care Act? He said, oh, it's great. It's this, it's that. The Republicans can't take this away. I said, but I've heard there are lots of problems with it. And he just said, oh, yeah, it's terrible. So
Well, yeah.
what is it? What I mean,
Well, it needs fixing, of course. It's
Okay.
and it was new, and nothing was going to get done while Obama was in power, because it was called Obamacare.
Wow.
and, right?
You know what? It's not terrible, first of all. It's
What do you think he meant then? I mean, without knowing anything.
I don't really know exactly. The thing is this: even if you look at what's going on now, where they may not have repealed Obamacare, but they're making the insurance markets unsure, they're not telling the companies whether they're going to be covered or not. So it's becoming harder and harder to find plans that are viable. But when it first came out, I called up my insurance agent. She went over the plan. Everybody received the exact same plan. And then depending on your economic standing, you would get a rebate so that the rates were much more manageable than they had been before. And there wasn't, pre-existing conditions you couldn't be excluded for. You couldn't have your rates raised if you had pre-existing conditions.
Right.
And,
That's a big one.
That's huge.
It was huge.
Yeah.
So it's like I don't really need a system that revamps the entire American health system to be perfect out of the gate. I just think that it's a big step that it was started, and if we didn't waste this whole year arguing about it and just kept making it better, I think that people would have been fairly comfortable with that incremental change.
Well,
Can I ask you, Gail? I'm sorry, Paul. Can I ask you a question, Gail? Can you explain the difference between what Medicare and the National Health Service, say in England or Canada, the difference there in terms of its relationship to private insurers?
I don't know about England at all, and in Canada, the way I understand it, people go to the doctor, they say, wait, what copay, what, they call up the doctor, they make an appointment, they get their care. Certain procedures, you may wait for. I'm not sure if you can in Canada get like a supplemental private insurance if you need it, but
you can, yeah. And it's
that seems like a perfect system.
But Medicare,
it's
all
more.
different.
There's more autonomy to the not states, territories, provinces. Then the funding comes from the government. A lot of the funding comes from the government, but it's also from the state, their provinces.
Well, but Medicare it functions slightly differently. Gail, can you explain how insurance works in Medicare and the private sector works in Medicare?
Well, Medicare covers 80% of your medical costs, and so really it can be quite expensive if you have only Medicare. Most people have a supplemental insurance, which you purchase either in California from United or Blue Cross, and that plan covers the difference between the last 20% of the care, and then Medicare has acceptable rates that they approve for certain procedures. So an office visit, they might approve a $65 charge, and so they'll pay for it. The secondary insurance will pay for the difference. In most cases, it'll be tagged to a Medicare rate that's all dictated through the government. And, that's it. If you're a Medicare provider, you have a place where you submit your claims electronically. They screw around with you a bit, and then you get paid, eventually.
There's still this huge private role for private insurance, though.
Well, private insurance administers it. Even the government part, I believe, goes through something called, I don't remember the MAC, Medicare Administrative Companies or something. Yeah, so the government doesn't do anything other than set the umbrella, set the big picture. It's all managed through private companies.
So would you say people should go ask for universal health care tomorrow night, 7 o'clock at the West Marin School? Say we want an NHS-style system, free at the point of service without the intrusion of private insurance to pay for it, or you think that's out of reach?
Well, I don't know. I don't know about an NHS per se. That's not a term that I've heard much used. I would say that people should expect really universal coverage. And that's why it's been switched in a sense to Medicare for All. That's by having a single term that's used, people can kind of start wrapping their heads around what it is that they're asking for. And I would say, that people should expect to have the majority of their care available through government, and whether they did it with a supplemental or whether there was a system that we worked out in the United States that was unique to our needs. I'm not 100% sure. The way that the Bernie Sanders plan is suggesting is medical, dental, mental health, vision, long-term care, all being covered. And imagine a population where you could continue, you wouldn't have to stay in a job or even a marriage that you were afraid to leave because you didn't want to lose your insurance coverage. Those are benefits that people really lose sight of. Right. Now everybody is like, oh, I can't leave my job. It has my health benefits. Or I have to do this horrible job because I get benefits, so I have to keep working. And so many parts of our lives are dictated by that insecurity.
Such a good point, Gail. Thanks so much for calling.
Yeah, thank you, Gail.
Excellent
I really
point.
appreciate it. Thank you, everybody. Thank you to our listeners. Thank you, Gail, very much for your expertise.